Thank you for joining us at this session, where this is a forum discussion that is part of the IMU Virtual Postgraduate Information Week. So over the past few days, we've had a few of these sessions for different postgraduate courses at IMU. And tonight, we want to look specifically into career progression for healthcare professionals as a diabetes educator. So before I continue, I would like to introduce myself. My name is Dr. Lee Ching Lee. Now, I am a dietitian by training, but I also am the program director of the Postgraduate Diploma in Diabetes Management and Education program at the International Medical University, or IMU. And much of my work actually in teaching, in research, even in patient care revolves around diabetes care and management, right? And today with me here to explore this interesting topic of advancing your career as a diabetes educator are four very successful people from very different professions in the healthcare setting who are also a profession in their own right, but also a diabetes educator. So we have Dr. Tan Ming Yong. Okay, we see her in a lovely scarf. Hi, Dr. Tan. She's a nurse by profession, right? And also a diabetes nurse specialist at the International Medical University. And she is one of the very few credentialed diabetes educators in Malaysia. And she has years and years and years of experience working in this field. So that's Dr. Tan. And we also have another fellow nurse with us, and that's Miss Grace. Yeah, Grace, are you there? Hi.
Hi.
Hi, yes. And Grace is a nurse by profession. And she currently works with the Ministry of Health Malaysia in Ipoh. And she is also a lecturer for a program, a diploma program, advanced diploma program that actually trains diabetes educators for Malaysia. So you hear a lot from her. And then after Grace, we have Miss Na Yingwa, who is a community pharmacist, practicing community pharmacist. Hi, Miss Na.
Hello.
Hi. Yeah, and interestingly, she's not with the government, but she actually co-owns her own independent pharmacy or retail pharmacy. So you also hear from that perspective. And then last but not least, a fellow dietitian, we have Miss Angela Teh. Hi, Angela.
Hi.
Yeah. So Angela is Malaysian, right? She has a dietetic background. She also has a postgraduate qualification as a diabetes educator. And today she practices in a government hospital in Singapore. So you see, we actually have very different professions here across different settings, and that's why we have this forum, because we want you to hear and learn from them about what they feel about this diabetes education field. Okay, so before I move on to the forum itself, let me just introduce some housekeeping rules to you. Okay, so we've actually muted all the microphones of the attendees. Okay, this is so that we can actually concentrate on the forum. But if you have questions, and definitely you'll have questions, do ask them. Now you can ask them by using the question and answer panel. So you'll type it into the panel, and I will be watching this panel for your questions. And if your questions come, right, we will either address your questions during the whole forum itself, okay, or at the end where we actually have an active question and answer session. So do send us your questions, because, you know, this is what this is all about. It's about you and about helping you understand how you can advance your career as a diabetes educator. Okay, so this whole session will be recorded, just to let you know, right? So we'll begin now with the forum discussion. Okay, let me just stop screen sharing so that you can see all of our panelists' beautiful faces. Right, so I'll begin with the first question, very broad. As I've introduced the panelists, they are actually very busy people. And I think all of them pursued a postgraduate certification. So they pursued further studies as a diabetes educator, even though they're busy working, even though they've got family to juggle. So that must come from somewhere. And so I want to know what has inspired you to do this. Maybe we can start with Angela, because on the screen you're just sitting next to me. Yeah, Angela, what inspired you to further your studies in this area?
I think while I was being a young dietitian, I mean, in 2-3 years in the field, I was kind of like quite sad to see some of my patients, how tough it is that people with diabetes, the ones I'm seeing as patients, had to live with wounds, and they had to go through kidney disease. They the to a point where it was end stage where they had to do dialysis. So some of them actually went through depression, and it was that point of time where I felt that there's something much more than diet education. I mean, there's something that I can do, because every time I meet a patient, it's a touch point, an opportunity to kind of help them wherever I can. And I felt that I needed to know diabetes condition holistically, and in order to do that, I had to go beyond my knowledge. So that's why I was actively kind of looking for programs that I could further in that. And yeah, so that's why it inspired me.
So it's that realization that just knowing what you have in your profession, for example, diet alone, even though they say diet is key to diabetes control, isn't enough to help the patients. It's not enough. So that's why you furthered. That's very interesting. So just furthering or getting the holistic approach for better patient care. Okay, what about yourself, Miss Na or Yinghua?
Yeah,
What made
yes.
what made you pursue further education in this area?
After my working for more than 10 years in this pharmacy field, so I can see there's a lot of gaps, especially in diabetes care, which cannot be met by our current practice, especially for pharmacists. We are always focused only on medication. So out of medications, we will think the patient need more, but we cannot help more. So whenever I met some patients that like Miss Angela said, they already voice out their needs, but it's beyond my capability to help them. So that's why I'm looking for something to expand my skills and to add more values in my service.
Okay. So the same thing. So just knowing about medication alone also does not help
Yes.
patients improve, right? Yeah. And it's quite interesting. You were saying that you had this additional point where you said it's also to add value to your service, is it?
Yes.
Yeah. You want to tell us more a little bit about that? What do you mean by that? I mean, in your context, yeah.
For example, when a patient come to me, so mostly they'll come to a retail pharmacist to ask for medications. But when we ask further questions, when we explore more, then we can identify their needs. So before the training, I can only give very brief knowledge about diet, very brief about how to to prevent the complications. It's very brief, and it's not enough, and they cannot see the results immediately or in a short term before the next appointments. So it will affect their confidence on me. So if I can provide more or even individualized service for them, it will help to add my service value of my service.
Yeah, I think I fully agree with you. When patients have confidence in us, they will come back, for follow-ups. And that's good for us as well, but it's also good for the patients, because quite a lot of patients living with diabetes, sometimes after the first or second visit, they disappear, from the system, right? And only to come back with complications. And we don't want them to disappear from the system, because good follow-up actually is very important for their care.
And their confidence is very correlated with how much they review themselves. If they are confident with you, they will review more. So
That's
you
right.
get bigger picture or more comprehensive. The information. That's why we can customize our plans,
Right.
and make our individualized plan more successful.
Yeah, I think that's important, because the patients nowadays can get a lot of general advice online. They can get it and social media, right? So what they're looking for from healthcare professionals will be the individualization. How can your advice help me be tailored to my lifestyle? But for them to do that, they have to review parts of their life, and then they have to be confident in the healthcare provider.
That's the hardest part.
The hardest part.
To make them to review themselves.
That's right. That's right. So very person-centered care. Thanks, Yinghua. And what about you, Grace? Yeah. you have been working in the government, very stable job, you know, you're already training diabetes educators at the government level. Then you say, I want to further my studies. I mean, if I was to just look at it from the surface, I would think, why bother? No point already, right? You're already training people. What inspired you to further your studies in this area?
Well, it started in 2018. Actually, I started to teach diabetes in 2013, where I started to look train to be the trainer for them. And I came to realize that, wow, diabetes develops so fast. The knowledge, I can't catch up. It is too fast. From 2 to 3 groups of drugs, and it jumped to 8 groups of drugs. No, it's going on and going on. I found that I'm very far lacking. When I came to ask to help MOH in training division to develop the curriculum again, I realized that the IDF knowledge are so such a big gap. So I decided to join the postgrad program to enhance my knowledge. Hopefully from there it helps in my not only to train the DEs, but it's also to help my patients in the surrounding area with my day in and day out in clinical with the student. So I thought it's very benefit from then on. Yeah. And and it is not it will be enough. I think another 5 years it will continue to develop and change.
Exactly. I think later on we can tap into Dr. Tan about how the landscape has changed, but I cannot fully agree more to what you've just said. You know, we've heard that, you know, just knowledge in your own profession is not enough to help patients. That's one. But knowledge today also is not enough, you know. We have to continue keeping abreast on the developments, because I think diabetes care is just the technology, the solutions, the medications, the treatment plans has changed so much, and it will continue to change. We have a lot of novel medications in the pipeline already, you know. So yeah, we just have to keep abreast so that we can give the best to our patients. And it's very important, I think, because diabetes is not only a local problem in Malaysia, it's a global problem. Yeah, quite a lot of people will be affected with diabetes, and you know, diabetes actually kills slowly. Yeah, and that is what we don't want to happen. Yeah. So Dr. Tan, yourself, you have chosen to specialize in this area, right? You did a PhD in this area. Okay, so that's like really pursuing diabetes care, you know. And you've seen so much evolve since your when you first started practicing. Yeah, can you share with us a little bit about why did you decide to do diabetes care? And also maybe, since the listeners here are also healthcare professionals, how has diabetes evolved from the past, you know, until now? Yeah.
Okay, when I first started diabetes training in 1987,
Okay.
I wouldn't say that what inspired me. I would say that I walked into it. And the time, you haven't heard of anything about diabetes education training in Malaysia. My husband is the one who pushed me to do it, because he was a state physician in Malacca. And so many of his patients has complication and nobody teaching them. So I more or less walk into it. And at the time you think of it, the American Association of Diabetes Educator, Australian Diabetes Educators Association, they only started formal certification in 1986. And I started my training in 1987 in Canada.
Okay.
So at the time, not even the Canada has the formal training. So I more or less did an attachment. Attachment in the Nova Scotia Diabetes Center. And it was a 6 months attachment, quite interesting, where a young lady like me walk into Canada and have to do attachment, have to do group education, follow them and follow a dietitian, follow the nurse. But they already have quite a well-established diabetes center there. But the training for diabetes educator was only formalized in Canada in 1988. So it was something very new that time. So and when I came back, I found it so interesting. I started talk to my patient about diabetes and things like that, and went around for very short courses, wherever there is, I would just go for short courses. And I only get my formal training, my formal certification from the Australia in 1994. So it was 6 years later, I decided, well, I have an attachment, something new here, but I wanted a formal certification. So I went to Australia, Royal Prince Alfred Hospital. The time was also a very new program in Australia also. There were not many of them. So we were trained in both theory and practical. Of course, there is an exam. You have to pass the exam. And during the time my class, we already have dietitian, podiatrists, pharmacy, nurses. We are all in the class learning about diabetes. So that was quite interesting. So when I came back, I just found that it is so interesting because every case, every person with diabetes, you meet them, is unique. They have their own story to tell you.
Right.
I'm sure, I think just now listening to the other three panelists speaking, so they are so unique. So that is where the interest, until today, after 36 years in this field, I still find it so interesting. That's why I carry on. And it's very important, and if to try to continue to enhance myself in more training, because diabetes is very, very broad. And so that we can, together with everyone, we can try to raise the standard of our own diabetes care in Malaysia, or hopefully somewhere globally also.
Yeah. So it's nice because from what you've shared, Dr. Tan, I could see that diabetes care, diabetes education has evolved from just very simple informal training, right, to formalized form, which is what some institutions, including IMU, offer. Plus now it also integrates, I think what we actually have here in our forum, the multidisciplinary aspect. So we don't sort of like just nurses study diabetes education alone, or pharmacists in their own pocket, or dietitians in their pocket, or doctors on their pocket, but there's value in studying this or advancing these skills in a multidisciplinary group, because different professions bring different perspectives of care.
Yes.
Right? Yeah. And what we've learned recently as well is the other perspective that's important is the patient perspective, right? That's why we integrated now the use of real patients. Ying Hua, you in the first curriculum you didn't have it, but in our revised curriculum we have now integrated real patients into one of the modules. Not simulated patients. We have to hunt down real patients with complications, and they come in as part of the case study as well, because they also have something to teach people like us. Yeah, so that's a multidisciplinary thing. Well, since you're on screen, Ying Hua, now when you studied this postgraduate degree, you did it while still working full time, right?
Yes.
You did it, you were married, you had children, and your children were young, I remember.
Yes. I'm still breastfeeding that time.
Yes, you were still breastfeeding. That's right. And that's right. And at that time, we didn't have the ODL mode where you do it 100% online. So there were times you had to come to IMU all the way from Malacca back here, right?
Yes.
While breastfeeding. And okay, now how did you juggle? I think this is something you want to share some tips so that our listeners can also, learn something.
Yeah. That time I'm travel daily during the face-to-face.
Yes.
Because my son is only 8 months old, so he needs me during night time. So I can't afford to stay for 1 week, the whole week in Bukit Jalil. So I travel daily. So for me, discipline and the willpower, you must have the willpower and discipline. So while at midnight, while I'm pumping my breast milk, that is my time to do my assignment, to study all the modules I needed. So discipline, but one part is good for working, for adult learners. IMU programs is flexible in terms on the mode of delivery. It's not like undergraduate students. So it's every sem we will only have 1 to 2 weeks face to face. So the rest is usually online, and the PPR also online. So it's like we can, but the most important is I own my own business lah. So I can adjust my working time according to the true. So but apart from that, we need to have a discipline also to in order to finish all the assignment needed.
Yeah. I think those are very wise words. I think those listening as well, if you are thinking of doing postgraduate studies while working as well, you can, it's possible. We have all these, everyone here have done this, including Yinghua, she's run her own business. But I think discipline, correct. I think planning ahead, you plan well ahead, right? Yeah, you schedule it well ahead, and discipline. Even though and I think what you also did was a lot of multitasking, like breastfeeding and doing your assignment. So you can juggle, we have to learn to juggle. Yeah, so was it worth it?
It's not easy, but it's worth it.
Worth it. Okay, we'll talk about later on about why it's worth it. So we've heard from Yinghua, who juggled young children, breastfeeding, own business, and she did that. So she disciplined, planning ahead, multitasking. What about yourself, Grace? Because you're just next to Yinghua in the photo. How did you juggle? Because you also were working and with the government, Ministry of Health, right? So how to take leave lah? You know, how do you take leave? How do you, and you have to teach your own students as well, see your patients. And I think at one time, you were also studying through the COVID-19 crisis.
Correct.
I remember that. Now,
exactly.
What was your secret? Yes, what was your secret to help you successfully go through this?
Yeah, it is not easy. I still remember it's exactly fall on the month of March. After the orientation, I met my classmate, and that's it until the graduation day. We met again. Yeah, not easy, but as I say, I think the first thing is coming is you must plan well. You must know that you are committed to it. You must plan well that you apply leave. You have to let your organization know that you are in the studies, so that you don't hold too much of holding two bigger tasks other than your existing tasks. I give away as a coordinator of the program for diabetes during I'm having my studies. I just hold as a secretary in the examination board. So that's all. Yeah, I'm thankful enough that although it within the COVID, and I received a letter asked to help in the front line. I say, oh my God. I say, I really cannot. Yeah. And I have to plan. I say, I can be a frontline, but there are certain months I cannot become a frontline. I have to come out from the frontline task. Yeah, that's why I negotiate, and with a genuine way, you have to really memohon and memohon. That is the only way. But I have a good support from my superior and a good learning ground that helping me in Alostar itself, and also Hospital Putrajaya. So I'm very blessed that I'm in the government, but I can see the endocrinologists are very supportive to me, and they never say it is COVID, you cannot come for the training. They do allow me to go in as long as you carry on your existing tasks. So this is very important. Like Yinghua say, discipline, plan well and plan well and plan well. Well, the plan can change anytime. You must be open-minded. It can change because the COVID sometimes it will be like MCO, and then sometimes you cannot cross the border. That's it. Yeah. Another challenge I faced during the study time, COVID time, is we lack of patience. You don't have enough case for studies. Yeah, so you really hunt for patients and look for the right patient for you to carry on your studies, because it's a real, we are having our clinical hours to fulfill. Yeah, I still remember that it's not easy.
So again, plan ahead, right? Whether you're working or not, I think sometimes life is also uncertain, right? But even though life brings uncertainties, if you plan ahead, and I think reach out for support, right? Don't be shy to reach out for support. You can still achieve your goal. right? It could be a little bit more difficult, but you can still achieve your goal and don't need to give up. So reach out. I think one of the things that we do in the program, because we know our students are working adults, right? We are very open. There is no wrong or right behavior, you know, because different organizations, different areas that have different challenges. You just reach out and say, you know, I'm having an audit, right? You know, I can't cope with this, or I can't find a patient. And then usually we try our best to accommodate, to help and try and make it work lah. Because you know why? I think we need a lot of diabetes educators, not only for Malaysia, but I think worldwide we need more diabetes educators, right? So we're just be flexible. Thanks, Grace. What about yourself, Angela? Yeah, when you were studying, you were also working as a dietitian, right?
Yeah.
Yeah, in Malaysia. Yeah.
Yeah.
How was it for you? What pulled you through?
It was like because I was the same batch with Grace, so we remember COVID-19 hit, and then we were all locked down all together. I think COVID was a good thing in a way, because lockdown meant time to study. So I think that pulled us through, because we took 2 modules, which was not really heard of for the part-time students to actually take 2 modules in 1 semester. But I think COVID helped in that way for us. Like what Yinhua and also Grace mentioned about discipline, I cannot echo that any more than what they said, because that was the one that, you know, really helped you to plan things through and then see things through, because that's the whole point. But the main thing for me was even though the task was big, maybe the assignment was big and I didn't know how to do it, but it was really just taking the first step in understanding. First step always helps, and then you build on from there. And it was one of the things that I find from this program. It was very structured, so it was easy to follow. You know what to be, you know what's expected, and you know what to be ready with. And it was helpful to know what's coming up, because then you have fixed, like you can ask questions, you have question in mind, then you know when and who to ask them from. So I find it very structured in that way. It was also helpful to have support from the organization. I mean, family was a great support as well. They were very understanding, space and time to pursue the studies. The other part of the support was coming from my organization, because they understood that I needed leave, some time off, and to have that space to really expand, and have that space to also use some of the patients in my, my pool in the hospital. While I was running clinics and inpatients, I was actually using, like, having some of these patients along as case studies during the program. So I think that kind of support was really, really beneficial as well. I found that what I was learning, because one thing that I felt was very, very most beneficial, and which helped me to push to finishing the program, was I found whatever I learned was immediately applicable or relevant to my care. So I felt that I was growing as a dietitian, I was growing in patient care. So I think that fueled that passion to actually, no matter what stress I'm going through, the passion is still there. Yeah.
It's nice what you're sharing about you know, how when whatever you've learned you immediately apply and you see yourself growing. Now that's very part of what we call adult learning. Okay, so we all learn in different ways. Children learn very differently from adults. So as an adult learner, right, we sometimes do what we call just in time knowledge, right? When we learn, then we use it and we see the effect, then we will feel even more motivated to go on. But if we learn and we don't use it, we don't see the effect on our life, you know, on our career, on what we do, then the motivation isn't there. So that's good. So I think I will use that tip, Angela, when I talk to new students or, you know, first year students. When you do whatever you learn, don't keep it in your books. Go and apply it already on your patients, because when you see the immediate effect, it keeps you going. I think that's very good. And also the support from just now, Grace, Yinghua also said, do not keep your postgraduate studies a secret from, you know, some people say, I'll secretly study. No, please let your important others know, your family, because they will have to support you, your organization, because they will have to support you, right? And Dr. Tan, yourself, you continued your studies, and I think for you, studying would be a bit, studying postgraduate when working will be a bit different, right? From now.
Yes.
Yeah. How
During
was
my
it for you?
time,
Easier or harder?
no, during my time, as
Huh.
mentioned earlier, in the 1980s, 1990s, there is no diabetes education program like what we are having now. So I actually have to go abroad. So it is very challenging, but not impossible. As mentioned by the other three, we really have to organize. At the time, my children are still young. So I have to organize, I go there for a few months. I have to organize to make sure they have been looked after. My work, I even have to employ temporary staff to replace my role. So it is, at least for Angela, Miss Inghua and Grace, in Malaysia, I have to travel abroad. So it is a different type of challenges.
Yeah.
I have to settle myself, make sure I get adapted there. But I think to summarize the thing, organize your time, you have to plan. Planning is very important. Support from family, from work, from your colleagues are very important. And I got to talk to my staff that I'll be away. I look for temporary staff, make sure they are well trained to at least take over temporary for a few months. So it's all about time management, determination, time management.
Yeah.
So I wish that I have like what you all have now. But the other thing that was very good when I studied my undergraduate, because I started at my time, there was no degree nursing also. In fact, I was a second batch of degree nursing in Malaysia. And I find that my degree nursing is very much the MU program, where you study by yourself. Then every 3 months, you go there and meet for a short while, a few days of classes. Then you go back and do your homework and read up yourself. And my master actually, and I never met my lecturers at all. It's all online. And but PhD, they did not allow. Every year, I have to go back for 2 weeks. They have to see our face for 2 weeks.
So it seems that the higher you go, right? That means the more postgraduate lah. So you go from degree, then you go to a postgraduate diploma, master's, PhD. I think there's a greater degree or amount of what we call self-directed learning or independent learning, right? That's why the organization is important. Because if you don't organize, then life takes over, family lah, dinners lah, work lah, deadlines will take over. So we just have to be organized, determined, and focused. Can I tap on you a little bit more, Dr. Tan? So you've seen, how diabetes education has changed in the way from informal to formal, how the landscape has changed from maybe just, I think when you're practicing, we only had what, not even metformin, is it? Is it just a sulfonylurea? Just
metformin and sulfonylurea.
Just only those two, right? And now it's expanded to so many, even non-insulin injectables, and we will have a lot more in the pipeline. Now, that one we know, but where do you see the future of diabetes care going and the role that diabetes educators play? Say in the next 5-10 years, is it going to remain stagnant? It will evolve? How do you see evolving? And where do diabetes educators fit in this future?
I think it's important. First thing, there's just not enough diabetes educators in this world. Globally, every country will tell you the same. Just to give you an example, in Malaysia, our own country, we have only, today when I listened to Dr. Zanaria presented her lecture, there are currently about slightly more than 1,000 diabetes educators in the Ministry of Health. Plus a few more in the private side, and like our PGDME alumni, I would say about 1,005. And we have 3.9 million people with diabetes.
That's right. That's a very poor ratio on diabetes educator to diabetes patients. And that's only Malaysia.
Yeah, and globally it's the same.
Yeah. Okay.
Whether you're in America, whether you're in Singapore, or whether you're in Australia, there's just not enough diabetes educators. Because one thing about diabetes education, managing diabetes education. It's not that managing diabetes as a disease. It's not that you go and see doctor give you medicine, you go back and swallow your medicine, that's all. As it was mentioned earlier, there are so many things goes on in their life. And the doctors, not that, I wouldn't say the doctors are not interested in teaching them. They just don't have the time. If you have another 50 patients sitting outside your clinic, they don't have the time to guide them, to answer the problems that they have, the challenges they face in life. So it is the role of diabetes educator. There is one thing I learned.
Yeah.
But when I was in Canada, when I was in Australia, that we are just something like the middleman between the patient and the doctors. Even until now, the rule is still there. But now with the modernization, with more higher literacy, you can see that more and more people are looking for diabetes educator. So the landscape has changed. Previously, the patient would just say that when I have diabetes, I go and see doctor. That's all. But now it's different. I'm sure many of you, some of you here, the patient come and look for you. Just now we are talking about follow-up.
Yeah.
This is very important. So, and the other thing about diabetes education as a career path. Previously, we always look for diabetes education, that means you're in the clinical. No, we have changed, the landscape has changed. If you have a postgraduate degree in diabetes education, the pharma love you. Those pharma company that sells diabetes related products, whether it's medication, whether it's anything to do with diabetes, even in nutrition, even in blood glucose monitoring, even in anything that is related, the pharma, they will definitely want to hire you because you give added value to their product. Nothing like a pharma rep going to the doctor's office. I have this degree. I know my product well. That is very important. And not only that, if you are not interested in these two fields, you can be you can teach diabetes in the academic position, because every program requires somebody to teach a student, and you can research. You can go into research. So the world is open.
Your oyster. The world is their oyster. Huh?
And this is a very niche. I would call it a niche profession. It's not like a nurse. It's not like a dietitian. If you are a general dietitian, so many general dietitians, so many general nurse.
Yeah.
But this one, there are so few of us.
Correct.
Whether in Malaysia, in the world.
Yeah.
And not easy to replace somebody, because we are trained how to engage with the patient, how to address the patient's problem, how to help them to cope up with their life. So it's it's not easy to replace a diabetes educator. Just get somebody there to start teaching the patient what is diabetes, what is hypoglycemia, and so on.
So to summarize, that means the future, the role of a diabetes educators you see expanding beyond just the clinical area or the community area. You could go into retail, into the pharma companies, into teaching, into research, correct? That's one. The other thing is, I think in the future, I don't see diabetes, the prevalence of diabetes plateauing off. I do not see that. So there'll be a lot of patients out there, but these patients will be looking for this added value. They want the whole package. They want a one-stop center. Basically, most places are going, I see this one person, and can that person be sort of like a one-stop center first for most of my needs? And that's where diabetes educators play a role. Angela, in dietetics, right? As a dietitian, how do you see diabetes education or care growing or expanding in the future?
I think it's being a resource person. like it's not knowing just about the diet. If let's say the patients, you notice that they are having insulins, or they're having some any other medication that can cause them to have hypoglycemia, we kind of can pick up from there and then kind of address the situation. If let's say they're having hypos and stuff, we can actually expand more than just asking them about what they were eating and just educating them on what they're eating alone. So I think we can be that person, a resource person to not only our patients, but also to the healthcare professionals, I mean, as a team as well in the diabetes care. So that's an added asset as, I mean, I can see that as an added asset now. I think the other thing would be, if we see the gaps in, let's say, the care that we're giving in our current workplaces, I think one of the things that really stood out for me, and I was thankful for studying postgrad, was while we were doing the health education module, there was a gap that I saw. I realized that there was a need to create a resource for patients, kind of like a guidebook. And the endocrinologist at that time working with me, because it was my previous workplace, my previous hospital. So she had this idea that, okay, how about we create this book for the patients? And she had like the whole idea of it. And I had the skills and I had the knowledge because I was doing health education module during the postgrad. Then I'm like, okay, I can take it up. And I was actually studying the module at the same time working on the project. And within a month or two, we've actually came up with the entire book. Yeah, and it's called a self-care journey book for patients with diabetes. And it can be used by anyone in the hospital, basically the consultants, the diabetes educators, literally anyone, as long as they have access to people with diabetes, because we want people with diabetes to have a good understanding from the get-go when they first are diagnosed. And that's where we have good diabetes self-management. So we wanted to create that sort of journey and self-awareness for the patients that were coming through our doors at that time. Yeah, so it's actually printed already, and hopefully it's being used in the hospital that I was previously working at. Yeah.
So it's interesting you pointed it out, because diabetes care is evolving, our patients' needs are evolving, and so the diabetes educators of the futures cannot only just apply, we need to create solutions for problems that today we may not see, but it could be tomorrow's problem, and we must have that skill to create solutions, right? And that's why, and actually the ability to create is why we pitch this program at the postgraduate level, because there's a lot of independent learning you do, a lot of case studies, because we want you to learn that creating skill to solve problems. So that's good. Thanks, Angela. We'll move on quickly now to Yinghua, because what about the retail sector? Retail pharmacy is different, right? It's not hospital.
Different.
Yes.
It's totally not clinical. It's not
Yes,
clinical.
that's right.
I'm agree with Dr. Tan. It's a very niche profession. So it will definitely help you to stand out among, your others colleague. Like you can stand out among the pharmacists. I'm the pharmacist, so I'm pharmacist, and at the same time, diabetes educator. So not many. So with this postgrad program, it will help you to stand out from the rest. And our patients now is like it's not like last time. So they are more educated, and the way they acquire their information about diabetes is totally different from last time. So we must equip with my knowledge and skills. So I think the opportunity is very big in the future, and the needs is evolving. So we need to evolve ourselves also to upgrade our knowledge, to polish our skills.
That's right.
So
that's right.
So and for my pharmacy, my ultimate hope is to serve as a one-stop center for the patient to get a reliable information, and someone is who are capable to answer their questions and to discuss with Is someone they are confident and comfortable to discuss their disease or their conditions. So instead of Google all the information, asking around, that's the future. Is a very big opportunity.
Yeah, yeah. That means that in retail, I think what's important, because there's so many players out there competing for the same market, right? So it's very important to differentiate yourself in a way that is meaningful, right? So I think studying a niche area like diabetes care and having the formal qualifications to say, okay, we are there, can differentiate yourself,
and this is the only formal program
so far in Malaysia at this level.
Yes.
Yeah, let's hope that it remains that way before other competitors also start to also ride the bandwagon. So for retail, it differentiates you. What about government, Grace? Yeah, what does the future hold for government sector like the healthcare sector and diabetes educators?
I would say that first of all, we really aware that diabetes educator is not enough. Whether the government itself is a trainer, they are training the own nurses and the DE, also not enough. Will never have enough. The problem is actually in government, you have to face two settings. One is the primary healthcare. You also have to face the tertiary healthcare. So really interesting. You can see both healthcare settings. They have their different extended role and function there as a DE. But I would think that the expectation of the patient also sometimes can be the same, sometimes can be very different. Yeah. The range of the patient also very variety. Sometimes you can see the mothers, GDM, they just come to the normal community. And then in a hospital setting, you can see the patient already ended with a renal failure, with the heart problems. This extended role actually need to be given to the DEs for future. I think in government setting, I remember when I started this, the DE are not recognized. Yeah, but today, we can see both settings are really much better. They are more established. So I also would like to encourage for those who are DE already, they have their post-basic, they can upgrade themselves in this program, because I can see that their demand are very big and the patients are very challenging.
I take it that quite a lot of the untapped, I think the patient's needs that are not met right now that diabetes educators can fulfill is actually the care of all your macrovascular complications, you know.
Exactly.
Because by the time they come to government, right, all these complications there, right? It's complex. Just nursing knowledge or dietetic knowledge or pharmacy knowledge will not cut it. Yeah, you need to have a little bit of that holistic approach to try and really right. So the time is now 9:19. I'm conscious of the time. We have some questions, right? So maybe we'll answer the questions first, and then we will end with what's your final take-home message that you want the participants to answer. So we have a question now. I'm going to read it out here. I think this question is from a nurse. Okay. This attendee has got 3 questions. I think the first question, I think Dr. Tan and Grace, you can answer. For nurses, what is the difference between these courses, our postgraduate diploma in diabetes management education, and then the post-basic or the diploma lanjutan penjagaan diabetes course by KKM or MOHI?
Grace, you want to answer?
Okay. All right. Okay. To answer this question, actually, previously our diploma lanjutan penjagaan diabetes, which is in English, is also called advanced diploma in diabetes care, is already replaced the post basic, and we no longer have this post basic diabetes 6 months in the training division. Yeah, the difference is the postgraduate have a deeper how to say, deeper in the sense that in terms of the program, and diploma lanjutan is just enough for right now the KKN setting. If you wanted to develop further after you have your advanced diploma, I think this is the best program. Yeah, like what myself did with IMU. Yeah. And at the same time, you can exercise more your extended role in your clinical setting. As what I mentioned earlier, the government hospital patient came in is not just a simple case, a very complex. So we need to enhance our knowledge in terms of that.
Dr. Tan, do you want to add anything else? What's the difference between the IMU course and also the diploma lanjutan by KKM?
Okay, if you look into our Malaysia higher education system, the advanced diploma is called MQA, Malaysia Quality Assurance. The one that the just now mentioned by Grace, the advanced diploma is a level 5.
Level 5. So that means after you take a diploma, you do the advanced diploma.
Advanced diploma.
Yeah.
Then
level
after
6
that,
is
you go
our
into
degree, isn't it?
degree, then only level 6. And the
Mhm.
postgraduate diploma is level 7.
Okay.
So
Okay.
the levels, that means you have the way they prepare you in your management are different. Just to give a very simple example. If you are a parent, or no need to be a parent, if any of your family members are not well, would you send them to a medical officer or would you send them to a specialist? Advanced diploma is like medical officers. Postgraduate diploma, of course, you have to add in with some years of experience in your clinical field. Just like a specialist, a medical specialist, when they finish their training, they are registrar, they are not a specialist. So by the time we are added clinical experience like all of them now have, you become a specialist. So even in the same case, you will look at the case very differently.
That's right.
You can identify more issues. You can address their issue differently. Yeah. Just like I'm specialized in diabetes. If you give me an ECG, to me it's PQRST, that's all. But a cardiologist or a cardiac nurse will say that, oh, I think there's an atrial fibrillation there.
Yeah, that's right. That's
no.
Right. Yeah.
I said, no, it looks like a PQRST.
That's right. That's right.
So you look at the case very differently and you address the case very differently. And that is where the patient build the confidence on us.
Yeah.
Because we could address their problem. I mean, as I have a lot of mentors after all these years. One of them is Professor Ma McGill. She always tells us, the patient don't want to know the pathophysiology of your diabetes. The patient come to you, the people with diabetes come to you to ask you to help them to solve their problem, right, because they're facing so many problems every day in their life. They don't want to learn about what is the action of the medicine.
Yeah.
When they have problem, of course they have to know some basic thing. But when they have problem, they want you to help them to solve it. And especially the IMU course, we address a lot on the psychosocial history, the psychosocial issues of diabetes. In fact, the global model of diabetes, the AAD 7-cell care, now psychosocial is psychological care is in the middle of the ring. You don't address that, nothing will work.
That's right. That's right. So we need that advanced training, that advanced knowledge to really manage diabetes. And that's the difference. Okay, we move on because it's 9:25. There are 2 more questions. Now, the second question I can answer as program director. The question is now on the course website, frequently answered question. It says that the program has now provisional accreditation by the MQA or the Malaysian Qualifications Agency. When will it be fully accredited? Okay, so now this program has got 2 modes. One is conventional, which is what I think our panelists here all took, okay, where you have to come for like a 1-week face-to-face session. Now for the conventional mode, we are already fully accredited, right? And we have actually achieved the next 5 years accreditation for full accreditation. So that's that. But this year, in order to make our program more accessible to working adults, from different states, so you don't have to travel, you don't have to come to IMU from different countries. We have also launched the same program, but in ODL mode. So it's open distance learning, meaning you do it all online from your home country, from your place, right? But there are certain sessions you have to attend live online, like today, right? So that one, because we have just launched it, it is under provisional accreditation, so PA. All programs are like that. We will have provisional accreditation for about the first 2 years. Then once we run the program, M2A will come in again to then accredit us and give us the full accreditation, right? So ODL full accreditation will be sometime soon already. I think we will start the accreditation process sometime end of next year and hopefully get it, end of 2024 or early 2025. So it's just a matter of time. Okay. Now the final question that this person has to ask is quite interesting, this is about practice, and I think anybody can answer if you want to. They ask you, do you find any resistance towards hospital-based diabetes educators from the doctors, don't care whether it's private or public, who actually prefer to provide their own diabetes counseling? Any resistance? Maybe Dr. Tan, because you work with a lot of endocrinologists who refer the doctors, right? Do you see this resistance?
Yes, it's very common. I would say that it is common among other than endocrinologists, because we are the endocrinologist team, and some family medicine are also very supportive, but some of them, maybe it could be due to lack of knowledge, lack of awareness of what the role of diabetes educators. So some of them, they will prefer to educate themselves. Some of them, they will think that, diabetes, the HbA1c is very high, refer dietitian. But a dietitian's role and a fully trained diabetes educator are rather different. We look at all aspects of care. Not that the dietitian is wrong, dietitian is part of the team. But I would say that, yes, it is, there are doctors like that. I could think that it is lack of awareness.
Lack of awareness lah. The rest, do you agree with Dr. Tan? I mean, I just see you nodding your head. I'm just smiling, you're smiling. That means smiles have very deep meaning, no?
Yes, it's common, but among those that not endocrinologists, all those specialists or endocrinologists really value diabetes educator, because they know it takes a team to manage diabetes.
Right.
It's not a one-man show work.
Right. So it's all down to lack of awareness, I think, when they don't really understand what the role of diabetes educators, because I think in Malaysia, the role of diabetes educators is starting to expand right now. We haven't reached what Australia and America are going to do, where they actually have advanced practice and all of that already, you see. So it's just a matter of time. So I think out there, if you are a diabetes educator, you want to be one, it doesn't just stop at you practicing as a diabetes educator. You got to also lobby your own profession, right? Talk to other professions, tell them what they do, advertise what you do, and then everyone will benefit. Yeah. Okay, it's 9:29, so we will have to end this, and we will end this with just that one take-home message. Okay, we'll start with Ningwa. If you had just one take-home message you would like to give to our participants today, what would it be?
If you want to take up this postgrad program, you really have to be passionate in giving health care to patients, because it's not easy, but it's really rewarding if you can really help your patients and really provide something more than their expectation.
Yeah. Okay. Thank you, Ingwa. What about yourself, Grace? What's the one take-home message you have for participants?
Right. I would say that continue to run all the DEs for those who are DEs and yet to be. Continue to run. Don't stop. There's a lot of things. I believe diabetes education is one of the very fun and challenging professions. I would say that. Yeah, it will be. I'm looking forward for that. One day it stand alone.
Correct. I think it will be, within our lifetime, we can see one for sure. Yeah. It's getting there. What about yourself, Dr. Tan? What's your take-home message?
I would say that, as mentioned many times in this forum, diabetes management is a team management. So irregardless of a profession, first thing you come to here to this forum, you're already interested. Irregardless of a profession, whether you are a nurse, a dietitian, a pharmacist, a doctor, I think there is always a place for you to further your care that you can provide to your patient. And I would like to emphasize again, it's a very niche profession because there are just not enough diabetes educator, even in another 10 years, because the number of people with diabetes is just growing too fast. And you will get a lot of job satisfaction because everyone is so unique.
Okay, thank you. And finally, Angela, what's your take-home message?
I think expanding knowledge in patient care will definitely benefit every patient you meet. And like Dr. Tan said, every patient is unique, and having that resource at hand to help them every step of the way is the one thing that, you know, gives us as healthcare professionals, providers, that rewarding satisfaction from the care that we give, and, you know, yeah, the value that we add to people's lives. Yeah.
Okay, great. So we've come to the end of the webinar. One new question just popped up. I see your question. Any scholarships offered? So what you can do is, can you write in to the IMU, the marketing division, or and then I will try to answer your question, okay, because of lack of time. But yes, if you're a local Malaysian student, there are certain bursaries that you can get depending on whether you're a member of certain professional organizations. If you're an IMU alumni, you get a bursary. I think MDES runs a scholarship for Malaysian healthcare professionals who are their members, right? So you can tap into that. But for international students, right now, we don't have a scholarship plan. But if you do take up the ODL program, it is now offered at a slightly cheaper rate than the conventional. Okay, so for the ones who want even more information about that, just write in and I will try to answer via email. Okay, right? So thank you so much to our forum panelists. I really enjoyed myself. You know, I thought I already know you guys, but today I know you even more. You know, and thank you so much for your sharing. And I hope to the participants, you have enjoyed this session. It wasn't a waste of your night, and you can now see clearer a little bit what diabetes education is all about. Okay, so good night, have sweet dreams, and wishing everyone a productive tomorrow. Okay, bye-bye.
Bye-bye.